Hi everyone, my name is Emma Caddey. I'm a medical radiation scientist working at Royal Prince Alfred Hospital in Sydney. And before I start with this presentation, I would first like to acknowledge the traditional custodians of this land. Today, I will be presenting a case study highlighting the use of the Quadra Total Body PET-CT scanner in staging prostate cancer with gallium-68 PSMA. A 61-year-old man was referred for a gallium-68 PSMA scan for newly diagnosed prostate cancer staging on the 1st of June 2021 with the Siemens Healthineers Biograph Vision Quadra Total Body PET-CT scanner having only been commissioned in the molecular imaging department at Royal Prince Alfred Hospital the previous day. The patient presented with increased urinary frequency and uptrending PSA on routine blood work. It's 1.6 in 2012, 2.6 in 2017, then 9.7 in March 2021, and 12 in April 2021. An MRI performed on the 5th of May 2021 found a PIRADS5 tumor in the left lobe of the prostate with suspicious inguinal lymphadenopathy. A biopsy was performed on the 14th of May, which confirmed a Gleason 9 prostate cancer. Touching on the technical details, the patient's BMI was 21 and he was injected with 235 megabecquerels of gallium-68 PSMA intravenously. The uptake time was 49 minutes post-void, and imaging was acquired in list mode on the Quadra from vertex to toes in 2 beds, with the torso data being acquired for 11 minutes, and then an additional 1 minute bed acquisition over the lower extremities. The Quadra is the first total body PET-CT scanner in Australia and the second total body PET-CT scanner in the world. The Quadra was craned into RPA on the 27th of March 2021, installed in April, and commissioned on the 31st of May 2021 for patient scanning. The Quadra's 320 crystal rings provide a PET axial field of view of 106 centimeters, which is 4-fold larger in comparison to our second PET-CT scanner on site, the Siemens Biograph Vision 600, which has an axial field of view of 26.3 centimeters. The larger field of view enables imaging of major organs in one bed position. The Quadra has significantly improved sensitivity of 109.7 counts per second per kilobecquerel in comparison to the Vision 600, which has a sensitivity of 15.4 counts per second per kilobecquerel. This makes the Quadra 6 times more sensitive than the Vision 600. The scan showed widespread disseminated disease. There was a markedly increased uptake with an SUV max of 12.4 in the left lobe of the prostate gland from apex to base. Both seminal vesicles were involved, as were small left pelvic, left internal and common iliac, para-aortic nodes to the cardioesophageal junction, and a very small 3 mm left scalene node with an SUV max of 11.4 at the base of the neck. Another small lesion was also seen in the bone marrow of the right ischium with an SUV max of 2.4, consistent with focal bone marrow involvement. In this coronal slice, the markedly increased uptake in the left lobe of the prostate can be visualized just here. And as you can see, the image quality is fantastic. Here are some sequential coronal slices demonstrating the scalene node. just here. The prostate lobe and the seminal vesicles. Nodal disease visualized here, all the way through to the tiny ischium lesion visualized on the last image here. The list mode data in the torso bed acquisition was separated into different time epochs to help determine the optimum scan acquisition time for our future PSMA studies on the Quadra. Here I have displayed some coronal slices ranging from the 1-minute reconstruction up to the full 11-minute reconstruction. So as you can see here, the 1 to 3 minute reconstructions are a little noisy. However, all of the reported lesions are evident even on just a 60-second reconstruction. The longer data acquisitions provided more diagnostic certainty and confidence with exceptional image quality due to the specifications of the Quadra I discussed earlier. Here are some more comparisons. Again, the 1-minute reconstruction is a little noisy. However, the image quality is vastly improved even after only reconstructing for 5 minutes. Here is the 3mm ischium lesion transaxially on the 60-second reconstructed PET. As you can see, the lesion is very faint with the SUV max of only 2.4. However, it is still visible while only being imaged for 60 seconds. This very small lesion in the bone changed the staging of this patient to clinical stage 4B disease. And after discussion at a prostate MDT meeting on the 17th of June, 2021, the patient was recommended for chemotherapy or systemic therapy rather than surgery. To summarize, the 4-fold larger axial field of view of the Quadra and its markedly improved sensitivity results in exquisite image quality, allowing detection of very small sites of disease, even when the scan time is shortened. This will have a significant impact on patient care in guiding the clinical staging of disease and thus influencing ongoing patient management. We are currently continuing to explore the optimal radiopharmaceutical dose and acquisition times for gallium-68 PSMA imaging on the Quadra. It is clear, however, from our preliminary experience that the Quadra is a game changer for patient care. Thank you everyone for watching. I hope you enjoyed this presentation. And if you have any questions, please feel free to email me. My email is up on the last slide. Thanks again.